Okay, at 12:01, I think we'll get started. Thanks so much to everyone who's joined us today for this latest Born Ontario briefing. As mentioned, we're going to be talking about our screening committees this afternoon. My name's Mari, I'm the Director of Born, and I have a number of people here today who are going to help me talk a little bit about what Born and PCMCH, the Provincial Council for Maternal-Child Health, are doing with the screening community in Ontario. So you'll remember, some of you, back on October 20th, we actually did a similar briefing around the Maternal Newborn Outcomes Committee and the Ontario Congenital Anomalies Committee. This is really the continuation of that session. So the committee structure at Born covers off these two areas, but we recognize that it'd be a little bit of information overload if we tried to do it all in one session. But we did receive a number of questions related to screening during that session, so we're quite excited to get to that portion of the structure now. So this actually is the second year of operations for these committees. Born and the Provincial Council for Maternal-Child Health got together a couple of years ago. Marilyn Booth at the Council, Susan Richardson with Born, as well as Dr. Prentice Chakraborty with both his Born hat and his newborn screening hat, came together to see what could be done to support the screening community in Ontario. And as such, three committees were born: the Maternal-Child Screening Committee, the Prenatal Screening Subcommittee, and the Newborn and Childhood Screening Subcommittee under the leadership of Dr. Joe Clark, Dr. Sandra Farrow, and Dr. Michael Garrity as inaugural chairs for all of those committees back in, I believe it was September 2010 or so. So today we're going to go through the membership, the scope, and the current activities of each of those committees. And to do that, I have the resource people, is that the right term? The resource people of those committees here to walk us through the slides. So Shelley and Janet have been kind enough to give up their lunch hour to talk to you today about screening in Ontario. With that, I'll pass it over to Shelley.
Okay, the next slide actually shows what you were just speaking to in terms of the organization of the governance structure, but I can just keep on going past that. So before we get going and launch into a description of the screening committees, I thought it would be appropriate to review the definition of screening. This definition that you see on your screen is part of a larger document that was derived by a working group of the Maternal-Child Screening Committee to provide a structure within which the committees and its subcommittees and working groups can frame their discussions on their policy recommendations. And so the definition reads, screening is a systematic, population-based application of a test or inquiry to individuals who do not have symptoms of a specific disease or condition in order to identify those who warrant further investigation and or intervention to achieve better outcomes. So in other words, a means of looking at a broad population to determine who may benefit from further investigation or other interventions. So we should go into Maternal-Child Screening Committee. And before we get going, I'll talk a little bit about the history. Historically, screening in Ontario was considered separately with regards to prenatal and newborn child screening. Until '94, with regards to newborn child, there was a formal advisory committee reporting to the Ministry of Health on newborn screening. This was disbanded, and for about 12 years, there was no group with a real formal advisory capacity. The Ontario Advisory Committee for Newborn and Childhood Screening was reconvened in '06, and its mandate was due for renewal in 2009, which is about the same time that a new structure was being considered, the one that we're seeing today. On the prenatal side, the multiple marker screening group evolved out of the initial trial of maternal serum screening that started in '93, and the report at the end of that trial recommended that the program continue. The screening community created this consultative group, which primarily operated on the goodwill of the community because there was nominal funding. And in 2005, all the funding actually was diverted to hospitals' global budgets. At that time, the group continued to continue its activities and didn't have any real formal status for a number of years. And when this new structure was created with the Maternal-Child Screening Committee reporting jointly to Born and the Provincial Council for Maternal-Child Health, this created a logical home for the renewed Prenatal Screening Subcommittee as well as the Newborn Childhood Screening Subcommittee. So what is our scope? Part of our scope definition, screening is an important practice in the maternal child population aimed at early identification of significant health risks to allow early intervention and improved outcomes. This committee was struck as it was recognized that neither prenatal screening nor newborn screening could be considered in isolation. Many health issues and diseases span the spectrum from preconception through childhood, and results from disease screening can impact on both sides of the birth event. The scope includes an integrated approach to ensure that policy recommendations are sound and consistent, and that operations of the screening programs corresponds to the highest possible standards of effectiveness, efficiency, and evidence. Now, prenatal screening and newborn screening are essential services offered to pregnant women and to newborns throughout Ontario. And although the details of the operation of each program may differ, the overarching principles of screening do apply to all. As stated earlier, the Maternal-Child Screening Committee provides advice via the PCMCH and BORN to the Ministry of Health and Long-Term Care and MCYS with regards to the scope and operation of prenatal, newborn, and childhood screening in Ontario, ensuring it meets the changing needs of the population. Consistent general principles of screening are applied to all aspects of prenatal, newborn, and childhood screening. The operations of these screening programs are integrated to the extent that relevant issues are considered in the full context of the reproductive cycle, and that policy decisions are based on sound scientific evidence, and the relevant stakeholders are identified and consulted with regards to proposed changes to the screening programs and, of course, any other issues as required. So, in order to fulfill the mandate and scope of the committee, membership has been drawn from a wide range of health and policy experts, as well as from across the provincial landscape. The chair is Dr. Prenatal, who is also the director of Newborn Screening Ontario, based here at CHEO. The MCSC is in the process of choosing a new vice chair. You will recognize that many of the other experts in this slide, all well known for their subject matter expertise and the breadth of experience they bring to the issues on the table. We would also like to acknowledge Dr. Joe Clark, who was the first chair of this committee and who launched the MCSC and has participated so knowledgeably and enthusiastically throughout this development process. The meetings for MCSC, we had our first meeting in September of 2010. 3 meetings were held last year, and 2012 will see the first full schedule of 4 face-to-face meetings annually. So the 2 subcommittees of the MCSC, the Prenatal Screening Subcommittee and and Newborn Childhood Screening Subcommittee, fulfill much of the mandate of the MCSC through their activities, and you will see that later in the presentation. Additional working groups that report to Maternal-Child Screening Committee include the group that prepared the definition of screening that was mentioned earlier. The next 2 groups have been recently struck. The Neonatal Jaundice and Bilirubin Encephalopathy working group is headed by Dr. Julian Little and Dr. Thierry Lacaze. The purpose of this working group is to consider and make recommendations as to whether Ontario should implement a universal screening system for jaundice amongst newborns. The next working group deals with the future targets of prenatal screening, and the leads here are Dr. Stephen Lai and Dr. Robin Hames. This group has been tasked to identify candidate targets for prenatal screening in the province. Now, both of these groups will be posting calls for expressions of interest in the coming weeks, and we encourage anyone interested in these issues to contact either myself or the chair or email us at info@bornontario.ca. Alternatively, keep an eye on the BORN website at www.bornontario.ca, and where the information will be posted there as soon as it's available. Lastly, this last working group has yet to be officially struck, but it is being proposed to look at congenital heart disease and the amenability of a combined pre- and postnatal screening methodology. So, as outlined previously, the Maternal-Child Screening Committee considers emerging issues that relate to screening as it impacts the maternal, newborn, childhood spectrum. Of particular interest are considerations that involve integration between currently existing screening programs. And the last point, well, of course, we do welcome questions at the end of this presentation. This is really to illustrate that the committee strongly encourages and welcomes questions relating to screening, whether surrounding practice, policy, or implementation. And if there are concerns or queries about the state of screening in the province or options that should be considered, we would encourage contact with the committee to bring those issues forward for review and for discussion. Moving on.
Moving on. With that, we're going to move on to the Prenatal Screening Subcommittee, chaired by Dr. Nan Oken. Okay. And Shelley, you're up again.
Keep on going. So, just going to go through these slides. This is the first of the subcommittees that we'll discuss today. The scope of the Prenatal Screening Subcommittee is to provide advice to the Ministry of Health and Long-Term Care via PCMCH and BORN, and via the MCSC, so many acronyms, as appropriate regarding provincial policies, standards, and guidelines for Ontario's prenatal screening program. So monitoring and reporting on program effectiveness and quality. We also make recommendations for changes to improve the program, to respond to questions that are referred to the subcommittee from the MCSC, to look at performance indicators and related data, to monitor and report on program effectiveness and quality, and this is done in conjunction with other agencies that are involved in prenatal screening. The subcommittee makes recommendations on policy and knowledge translation and evaluates and advises on new technologies. We have more to do. We advise on...
It's a really busy subcommittee.
Yeah, so much work. We advise on and facilitate implementation of specific protocols regarding prenatal screening, also on procedures for handling of screen-negative and positive results, and this includes genetic counseling issues as well. We advise on educational programs for patients and healthcare providers, and to reflect, allowing those to reflect any significant changes in prenatal screening. And we also look and evaluate research necessary to enhance understanding of matters related to program effectiveness and, again, other issues as needed. So here is our membership. As with the MCSC, the group is comprised of a range of professionals with recognized subject matter expertise. This interdisciplinary committee, you can see, is chaired by Dr. Nan Oken, and vice chair is Dr. Ritu Al, who's a clinical geneticist in Toronto. We'd like to again acknowledge Dr. Sandra Farrell. She has driven and guided almost all of the previous incarnations of this group and was instrumental in launching this particular subcommittee and was also its inaugural chair. So thanks again, Sandra. The Prenatal Screening Subcommittee has met twice in the first year, or in 2010, and we've had 4 meetings a year since, and we've got 4 coming up for the remainder of 2012. So there was a lot of work outlined in our scope, and you can see that from our list of working groups that are all currently in action. The clinical working group is headed by Nicolette Katia in Toronto, and this working group is meant to provide advice as appropriate with regards to clinical issues surrounding prenatal screening. The chemistry advisory group is headed up by Alan Dennis in London, and this is providing information and advice regarding efficacy and efficiency of the standards and the guidelines that are used by the laboratories who perform and report these screening tests. The evaluation group, which has been headed by Wendy Machino at North York, identifies quality indicators to be evaluated through BORN, for example, screening uptake and screening performance measures. The Nuchal Translucency Quality Assurance Working Group is headed by Nan Oken, and the goal here is to create a provincial program for quality assurance in the measurement of nuchal translucency during the 11 to 14-week ultrasound scan in Ontario. The Education and Website Working Group is headed by Dr. June Carroll, and the biggest task to date from this group has been the preparation of the new Prenatal Screening Ontario website. And the last group here is the Prenatal Ultrasound Working Group, and this is headed up by Drs. Walter Romano and Greg Davies. This group is tasked to evaluate the provision of prenatal ultrasound in both community and hospital settings and to identify any issues and make recommendations with the goal of ensuring consistent quality practices across the province. Now, a call for expression of interest for this particular group is planned to be posted on the BORN website next week. The group is looking for specific subject matter expertise in the areas of maternal-fetal medicine, radiology, ultrasound, and obstetrics. And so anyone who's interested, we would really encourage you to keep an eye on the website or email me or info@bornontario.ca, and we will make sure that you're considered. So to date, the committee has finalized the terms of reference within which we work. The website has been developed and is at the URL you see there, www.prenatalscreeningontario.ca. It primarily contains the information that was developed by the Genetics Education Project for the brochure that was published a few years ago. The brochure itself is available on the site as a PDF. It can be downloaded and printed. At present, the site is currently static. We'll be providing periodic updates, but we're not going to be monitoring the site live on a regular basis. It will just be updated as needed. With regards to the requisition, the clinical group has updated the requisition to ensure that there is consistency across the province. And the requisitions for all 5 labs will be available on the website for download in the coming weeks. So they're not up there just yet, but they will be there shortly. And nuchal translucency quality assurance, we have created a mock-up of the report that we're hoping to use, and we're in the process of drafting communications to the sonographic community in Ontario, just to advise them of the status of the initiative and to garner some feedback.
I think I'm going to jump in for a second. It's worth noting that the nuchal translucency quality assurance work is very interesting, and we've actually partnered with the UK to learn from the work they're doing and are able to reproduce a lot that has been proven out there, but obviously adjusting it to the Ontario community. But it's been a really interesting road to get us to that report.
Other things that we're up to, actively involved in a variety of pursuits. We are monitoring and evaluating technological advances in prenatal screening. Of course, the current hot topic is cell-free fetal DNA, and the subcommittee is keeping abreast of current projects, including those that are happening across Ontario. We're also looking at prenatal screening software that's currently available, and in the hopes that we can move to a seamless integration and communication between all 5 of the province's prenatal screening laboratories, as well as between the laboratories and Bourne. While the MCSC has struck a working group that is looking specifically at future targets of prenatal screening, this is also within the purview of the Prenatal Screening Subcommittee, and members of the subcommittee are taking an active role in that working group. And in addition, and in kind of relation to the last point, Prenatal Screening Subcommittee is also looking at the role of ultrasound in prenatal screening beyond the NT measurement. This involves looking at the utility of the first trimester scan to provide indicators of early fetal health, as well as looking at a more systematic approach to second trimester ultrasound and how fetal anomalies are identified and managed. And that is what we're doing.
It's a very busy subcommittee. It's remarkable. If you look at the history, you can understand why. There are years of work that continue on through this group of volunteers. So with that, Janet is now going to take over and speak to you about the Newborn and Childhood Screening Subcommittee.
All right, so the kind of broad scope of the committee is to provide advice to the Ministry of Health and Long-Term Care via the Provincial Council for Maternal and Child Health in Bourne, Ontario, regarding provincial policies, standards, and guidelines for Ontario's newborn and childhood screening program, as well as advice to Newborn Screening Ontario directly. So more specifically, our scope, which is somewhat similar to the Prenatal Committee, is monitoring and reporting on current program effectiveness and program quality, making recommendations for change to improve the program, responding to questions referred to the committee from the Maternal-Child Screening Committee, developing, implementing, analyzing, and evaluating performance indicators, evaluating and advising on new technologies, making recommendations on policy and knowledge translation, advising on and facilitating implementation of protocols and procedures for handling of screen-negative and positive results, including genetic counseling issues, advising on educational programs for patients and healthcare providers, and advising on research necessary to enhance understanding of matters related to program effectiveness. The membership for the committee is composed of a number of individuals with a broad expertise background, including metabolic specialists, endocrinologists, epidemiologists, as examples, as well as from a broad geographic region across Ontario. The chair of the committee is Dr. Michael Garrity, who's the molecular geneticist in Ottawa. Dr. Murray Potter is the vice chair, biochemical genetics in Hamilton, and I'm the resource person for the committee. I'm a genetic counselor in Ottawa. So the goal of the committee is to, or the subcommittee is to meet 4 times annually. However, there are the subgroups, the working groups and various projects. Those groups may meet more frequently, either in person or by video conference. So for the working groups, some have been completed, some are still ongoing. So the Quality Indicators Task Force, this was developed, we developed a list of quality indicators and have integrated the reports to and from board. These include collection, transport, lab performance, retrieval and diagnosis performances. The long-term outcomes have not been developed. For the Process for Addition Task Force, this is a formalized process of reviewing conditions and tests that would be added to the Newborn Screening Ontario panel. The guidelines aid in the review process of the committee, but are also of use for those applying to have the conditions added. So SCID, for example, has just been reviewed and was a working group. So this was the first condition to use this formalized process and was presented at the last subcommittee meeting and was recommended. It's now awaiting to be presented at the next MSCF meeting. And CF, long QT syndrome, and hyperbilirubinemia were also considered under the last committee. The review of Newborn Screening Ontario Test Menu Task Force is a new one, and its goal is to develop a model to review existing conditions on the newborn screening panel, such as how is the test functioning, have changes occurred with regard to the detection, treatment of disease, should it remain on the panel, should a second-tier test be implemented, et cetera. Storage, Usage, and Descent Task Force. There are policies in place on the Newborn Screening Ontario website, and these issues have been discussed at the last committee and will continue to be reviewed. So from the progress to date for the committee, has included the developed a process for the addition of diseases to the newborn screening panel, recommended adding SCID to the newborn screening panel in Ontario, completed quality indicators and short-term follow-up, and developed a born report inventory.
Thank you. So with that, first, of course, thank you to Shelley and Janet for pulling together all of the material from all the various working groups and subcommittees that keep all of this rolling, and taking the time to present it. I also obviously want to thank all the volunteers who make these committees happen. Everyone involved is a volunteer, bring a huge amount of varying subject matter expertise to the groups. As you can see, it is a significant commitment with 4 meetings per year, as well as the working groups underlying those meetings, and really providing the content. Takes subject matter expertise, but also a fair bit of passion and commitment. And so to the membership, we thank them very much for all of those efforts. So at this point, we move into question and answer period. I believe we have the chairs on the line, so we have all the people we need to help answer these questions, along with the resource team here in the office with me. To ask a question, you can either type it into the chat box, and I'll read it out, or you can press 01, which will put you in the queue. So that's 01 on your keypad, puts you in the queue. You'll be asked to ask your question when your turn comes up and have an opportunity to talk to the group and have your question answered. If someone asks your question before you get a chance to, you can press 02 to get out of the queue if you change your mind about asking your question. So 01 to get into the queue, 02 to get out of the queue. So it's going to scroll up here. The first question is about an updated requisition. So this relates to prenatal screening. The question is there a new MMS requisition form? How will healthcare providers be alerted of this, or is it up to the genetic clinics to inform their local healthcare providers? So there is,
It's been minor changes, but yes, there is a new requisition. It is going to be posted on the website, as I said. So, and each center will be able to access the one that's more specific and appropriate for their region. With regards to alerting the healthcare providers to the availability of it, it'll be on the website. I don't think there are plans to do any kind of mass communication strategy with regards to it because the changes have been fairly minimal. And so we'll just, when they are calling to ask for more requisitions, we're hoping that centers can actually point them in the direction of the website. I don't know if anyone else wants to add to that.
Nan, are you on the phone? Anything to add? Nope. Okay. I hope that answers the question. And so with that, we are going to take questions from the line. Not sure.
Mari, we have one person who is calling in. I'll unmute. The phone number is 416-813-1500. I've unmuted you, so you can ask your question.
Okay. This is David Chitayat from Sick Kids, Mount Sinai. And I'm concerned regarding preconception parental screening that nobody is taking care of. I'm talking about screening for things that are related to ethnic backgrounds, such as thalassemia, sickle cell anemia, and I'm not talking about newborn screening. I'm talking about parental screening. And the most important thing is that we are far way behind with the cystic fibrosis screening, Fragile X, and spinal muscular atrophy. And I have been preaching about it since Born was put together, and nobody is answering. Who is doing this screening? Who is in charge of it? When are we going to start it?
Thanks, Dr. Chitayat. We're in the very fortunate position of having the chair of the Maternal-Child Screening Committee in the room. So I'm going to pass the question over to Dr. Chakraborty.
Yeah. Hi, David.
How are you?
Not too bad. I
bothered you a couple of times about it.
Yeah, and I think you discussed this with Joe as well when he was chairing that committee. To be honest, I'm not sure where that discussion with Joe went.
Went nowhere.
Yeah, so I think you raise a good point. I mean, it's definitely one of the reasons why this committee structure was conceived, was to be able to deal with questions beyond what we're already dealing with in the province of Ontario in terms of screening, and why Joe felt it was very important to get that work done on what is a definition of screening as well as a framework under which screening can occur. During that working group, we definitely used concepts of preconceptual as well as carrier screening prior to or at reproductive age as one of the models by which we could help define screening. And certainly I think it is, would be within the scope of the definition that we came up with, which is a test or inquiry applied to, a population not previously knowing whether they are at risk or not. And we haven't set up a working group as of yet on that, but from your bringing up the question again, I think maybe we'll put it on the agenda for the next committee meeting, and you might be a good person to have involved with a working group if we were to set it up.
I'm curious, does it fall under the purview of the prenatal screening subcommittee, or would it sit at the maternal-child screening committee?
Yeah, I don't mind. I mean, I'm on the prenatal screening committee, and if it will fall into this is something in between, but this is the only preventive test that needs to be done, and urgently, because every year we lose, I know about myself, 3 to 4 cases of spinal muscular atrophy, dying in agony.
Yeah, and I think
we need to do something about it. 95% detection rate. We can't leave it like that.
And with increasing talk of newborn screening happening for spinal muscular atrophy, I think that's a lesson we learned from.
But that doesn't, it doesn't solve the problem when the baby is being born with spinal muscular atrophy.
Full conception to birth time frame. So I think SMA is a good point to raise.
Good. So on the agenda for the next meeting, it sounds like, for discussion. Thank you.
And this is what we were getting at in terms of, send us the questions. And I think after we've gone on our feet over the first year under Joe's leadership, I think we're actually ready to start addressing some of these kinds of questions.
Okay. Pranish, I'm not on your committee. I would love to be involved in that.
So again, I think I'll bring it up, and if we decide to go by a working group, we have to decide where it would go and report to, but, we'll take this as a formal inquiry again.
Okay.
Thank you very much. Valerie, do we have any more questions in the queue?
No, there's no more.
Okay, we've got one more on the chat window. Bear with me. This is a question regarding future plans for perinatal health reports for health regions. Can we expect to see reports at the health region level anytime soon as a follow-up to the 2008 report available on the website? That's a question for me. It's a good question. So we did the 2008 Public Health Region report. We then did 2010 LIN reports. Since those went out, we've been really, really focused on the Born Information System go live and development, which I'm ecstatic to report is rolling out beautifully. And we really now are turning our heads to how we're going to focus our next set of reports. We've gotten a fair bit of feedback on various directions we could take it. A lot of information is going to be available sort of on an ad hoc basis through the Born Information System, so it's going to be more of a self-serve environment. That will reduce the need for the very big formal reports to cover every region of the province. In fact, those regions can come into the system and get their own information for themselves, much more environmentally friendly, but also more user-friendly and people being able to access the information relevant to them. But we are just undertaking, like I said, planning for our next set of reports out of the Born Science team and appreciate any and all input on what people would like to see. I hope that answers that question. Another question, are there any markers in the current newborn screening that show any trends in the work being done on autism? So I have a feeling that's a pretty big question, and I'm looking to Pranish to see if that's something we should maybe take offline or if we can try to address in this context, whether there are markers in newborn screening data, I guess, that show trends in work being done on autism.
Yeah, so I think that's an excellent question, whether there are any existing markers that may allow for any risk stratification in terms of whether or not a particular newborn or child may be at risk of developing autism, or whether, new markers that are not currently being measured should be measured to try and stratify for risk of autism. I think for the first question, that's really a research question that I think Ontario has some unique tools, including the availability of ISIS and having the newborn screening data available at ISIS to try and link to outcomes like the development of autism. So I know there's an interest in pursuing that kind of research at ISIS, both with autism or with other developmental outcomes. In terms of expanding to include autism with new markers, that's not something that's been formally looked at, but could be that kind of question could be a very good question for the newborn and childhood screening subcommittee. Screening for other developmental risks using biomarkers would definitely be within the purview of that. Not something that's actively happening.
Good. Thank you for that answer. So we have no more questions in the chat box. Valerie, any more? Yeah?
Yeah, there's one more that popped up in the queue here.
Very good.
It's 416530.
Go ahead and ask your question.
Hi. I have a question, and it kind of has to do more with Aboriginal population. And I'm not sure who it would be directed to maternal newborn outcomes, I'm guessing. I'm wondering what Aboriginal stakeholders have been consulted in the changing of the database. By Aboriginal stakeholders, I mean a community level of consultation in Ontario, so maybe the Métis Nation of Ontario, ONWA, Ontario Native Women's Association, Chiefs of Ontario, if any of these people have, or these organizations have been consulted, and what way is the data from that BORN collects about the Aboriginal community and population, what way is that information going back to the Aboriginal community?
It's a really good question, and I'm going to do my very best to answer it. And Sherry Kelly has joined us to correct me where I may misspeak, but absolutely. So we have had conversations with Janet Smiley through the development of the BORN information system to understand what needs to be done. And that work is really just starting. So we have a job posting now posted for a coordinator to help with that work and to make sure that the appropriate engagement is being done, to your point, on what we collect, but also what we use that information for. So it's about data in and data out. So that engagement has started. Historically, when we look at the historical data sets that came into BORN, there was some information being collected. We have disabled that pending this engagement and pending these conversations and decisions. So we're not currently collecting Aboriginal status until that engagement has been completed. I keep staring at Sherry here to make sure I'm not saying anything wrong. Is there anything you want to add?
No, that's all correct. But just to add that we had contacted recently the Ministry of Health and Long-Term Care to get the list, as you mentioned, of Aboriginal stakeholder groups. And we're in the process of organizing meetings with these groups, both as separate groups or all together. So that is definitely a plan, and that's part of the Ontario Congenital Anomalies Committee work. So thank you for raising it, and yes, it's being addressed, and we'll keep the group informed as we proceed.
Okay, thanks.
Thanks for the question. Val, any more in the queue?
No, that's it.
Okay, well then I thank you all for attending this latest BORN Ontario briefing and look forward to speaking to you again in another 6 weeks. Enjoy your day. Bye-bye.